I spend half of my time talking to people about why they're not going to get it, what it's going to cost, what should be done but can't.
Shame! 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 Shame!
For such a rich country, the United States has terrible health care.
They billed our insurance company over $3 million for the cost of transplant.
The world's richest country doesn't guarantee health care as a right.
That's what freedom is all about, taking your own risk.
Medical bankruptcies are soaring. Over 60% of bankruptcies in the U.S. are caused by medical debts. Life expectancy is falling. The U.S. has the highest rate of mother and baby deaths for rich countries.
Nobody dies because they don't have access to health care.
And all that with a price tag higher than any place on earth. Almost $13,000 per person. But you've heard that story before. What you probably haven't heard is the story of the small Caribbean country that achieved what so many in the US claim is impossible. This is a story of a country that prioritized the health of its people to deliver a high standard at a fraction of the cost, and all while under a crushing economic embargo.
These trade sanctions have survived 12 presidential administrations, becoming the longest embargo in modern history.
The situation in Cuba is pretty bad. This is economic warfare.
We've seen far lower levels of both deaths and infection rates in Cuba.
How can one of the poorest countries in the Western Hemisphere achieve such impressive health outcomes?
Welcome to the story of Cuba's astounding health system.
En las minas del frío se está llevando a cabo un plan intensivo de prevención y erradicación de la tuberculosis entre los becados de la zona. En la plaza cívica de Minas del Frío se celebra el acto de presentación del servicio médico rural a los becados. El personal que trabaja en esta labor lo integran 19 médicos, 5 técnicos especializados en el método de rayos X y 2 enfermeros médicos. Los alumnos pasan por un examen físico total.
In the middle of the last century, falling sick in Cuba was expensive and deadly. Before the revolution in 1959, Cuba's rural infant and maternal death rates were the second highest in the world. 80% of children suffered from intestinal parasites, and it was the #1 cause of death. But things changed rapidly after the revolution. By the 1980s, Cuba had eliminated most infectious and poverty-related diseases and had the health profile of a highly developed country. Cuban healthcare, driven by the government, then moved on to developing cures for non-communicable diseases like cancer and diabetes. By the 1990s, they had set up a world-leading biotech industry that was run for public benefit. Soon, this industry's innovations outpaced those of rich countries and big pharma. In 1988, Cuba produced the world's first meningitis B vaccine with 95% efficacy and was awarded a UN Gold Medal for global innovation. Scientists produced a vaccine for the first time in the world that would train the body to trigger the immune system in case of tumors and produce cancer-specific antibodies. In 2015, the World Health Organization announced that Cuba was the first in the world to eliminate mother-to-child HIV transmission. In the COVID-19 pandemic, Cuba vaccinated almost its entire population using 2 highly effective homegrown vaccines, developed at a cost of just $50 million. The list goes on. How did Cuba go from having one of the world's greatest disease burdens in 1959 to being a pioneer of medical science? This isn't the story of a few innovations and miracles. There is no silver bullet here. So how did Cuba do it?
A partir de aquella fecha, el socialismo quedó para siempre cimentado con la sangre de nuestros obreros, campesinos y estudiantes.
Let's start from the beginning. In January 1960, Fidel Castro, the Cuban leader, declared, "The future of Cuba will be a future of men of science."
Orgullosos del nivel científico, el nivel moral y el nivel revolucionario de los trabajadores de nuestra salud.
Within 1 year, illiteracy fell from 23% to 3%. New schools, colleges, and universities opened, and professional courses were introduced, and thousands of Cubans trained as scientists and engineers over the next 2 decades. But this wasn't science for the elite. The universities opened their doors to children of workers, peasants, and non-white Cubans for free. Provincial medical schools encouraged professionals to practice where they grew up, and the new model of community-based polyclinics was born, bringing specialists like gynecologists and pediatricians to far-flung villages. And finally, in 1976, the Cuban Constitution enshrined free healthcare for all, guaranteeing the advancement in health, education, and literacy of the 60s and the 70s bore fruit for all the generations to come. But the real biotech miracle had yet to come. The biotech industry in the United States was launched with venture capital. Science was business, and its task was to create markets. In sharp contrast, the Cuban biotech industry was completely integrated into the state-funded public health system, and it was not for profit. Cooperation prevailed over competition as research and innovation was shared between institutions. The president of a multinational pharmaceutical company once told Agustin Laje, director of Cuba's Center for Molecular Immunology, that he was bound by his shareholders' interests. Asked how many shareholders his company had, the big pharma boss answered that it was 300,000. Ah, Laje replied, well, I have 11 million. Our shareholders are all 11 million Cubans. The beneficiaries of Cuba's health leadership have extended far beyond the 11 million Cubans in the shores of the Caribbean island state. Whenever there is a health emergency, Cuban doctors are often the first to show up. Take the 2014 West African Ebola outbreak. Cuba was the first country to respond to a WHO appeal for international assistance, sending the largest medical contingent to take on a highly contagious disease. Over 10,000 Cubans had volunteered in just 2 weeks, despite Ebola's 50% death rate at the time. Countries in the global north sent finances and supplies, but not the urgently needed medics. The selected Cuban medics quickly reduced the mortality rates of their patients to 20% and introduced a preventative education program to stop the disease spreading. A New York Times editorial exclaimed, "The work of these Cuban medics benefits the entire global effort and should be recognized for that." Since 1960, Cuba has sent medical professionals to work in 164 countries around the world. What explains Cuba's commitment to internationalism? The more lurid parts of Western press claim that Cuban doctors are slaves to the government. The reality is that medical diplomacy is not a sinister scheme. It is simply a commitment to health as a human right for all, within and outside Cuba.
Es sencillamente la convicción y la necesidad de dar nuestro aporte, como siempre lo hemos hecho, a un país hermano.
Inclusive, para uno es hasta un honor poder servir a los demás. Ya es parte de la filosofía interna de uno.
I trained at Cuba's Latin American School of Medicine, probably the world's largest medical school, established especially to train foreign students to deal with the urgent need for healthcare workers in countries across the global south. WHO Director Dr. Margaret Chan once said, "I know of no other medical school that offers students so much at no charge. I know of no other medical school with an admissions policy that gives first priority to candidates who come from poor communities and know firsthand what it means to live without access to essential medical care. For once, if you are poor, female, or from an indigenous population, you have a distinct advantage. This is an institutional ethic that makes this medical school unique." That was exactly my experience at the school. This institutional ethic pervades Cuba's health system, at home and abroad. But it faces a familiar threat, the 6 decades-long US embargo designed to shut Cuba off from the world. UNICEF reported that Cuba could not import nutritional products for children, and it is believed to be a contributing factor to the high prevalence of iron deficiency anemia. Hospitals are understocked as the US embargo has forbidden the export of medical technology with US components, leading to a chronic shortage of some over-the-counter medicine and medical equipment. According to Oxfam, Cuba is unable to get medical supplies that are only manufactured by the US or by subsidiaries of US companies. For example, the Kodak X-ray film recommended by the World Health Organization for use in breast cancer screening is not available to Cuba because it is manufactured in the United States. Prostaglandin, a drug used to induce labor, is not available to Cuba because it is only manufactured by a US pharmaceutical company. Substitute drugs carry higher risks for mother and child. These sanctions force Cuban healthcare to treat patients with one hand tied behind its back. But sanctions and shortages have not diminished Cuban healthcare outcomes, which are comparable to those of rich countries. The Cuban model stands tall. It shows that if you prioritize science and the health of all with an integrated, innovative, public, not-for-profit model, you can achieve great things. The world is calling on the US to end this cruel and merciless embargo. In 2020, in the midst of the pandemic, UN experts declared this is a matter of utmost importance and great urgency. In the face of a global challenge, no one should be denied vital medical care. Cuba doesn't need our charity. It is owed our gratitude for debunking the myth that good healthcare costs the earth, and for showing us that health is our government's responsibility, not a source of corporate profit. For this alone, the embargo must fall, and the Cuban model should travel the world.
Revolución es unidad, es independencia, es luchar por nuestros sueños de justicia para Cuba y para el mundo, que es la base de nuestro patriotismo, nuestro socialismo y nuestro internacionalismo.